Our population is growing and people are living longer. That's a good thing, but we have to plan ahead so that we have a health service that takes account of that. Sláintecare started off in 2016 when we set up an all-party committee to examine how we could reform our health service. We felt that the best way that we could make progress in medium to long term is to have a consensus around the changes that needed to happen. But it's a totally different approach. It's a 10-year plan to reform and modernise our health service.
I'm looking after John today. He comes in here every 6 weeks for an infusion. He's given an appointment time. He's usually in and out within a 2-hour time scale, which is more conducive to his work and family life. But at the same time, we have a direct link to the hospital setting if required.
Care in the community is a huge difference compared to the busy hospitals all the time as well, yeah. It's more kind of one-on-one with the nurse as well. So you kind of feel like you're looked after better, you know.
Sláintecare is going to be a game changer. Nobody wants to be visiting the A&E at any time of the day or night, and people are only too happy to take up any of the supports, guidance and advice that we can provide them with online, in person or over the phone.
This is actually quite unique to have an all-party agreement in terms of where health should go in the future. We live in a connected society, and the integration of healthcare systems and the provision of healthcare across that society is really important.
We are dealing with integrated care in Kilkenny for many years. We have a system here where GPs work with consultants. We actually stream our patients directly to the hospital with GP access. So people are not waiting, it's reducing admissions, it's reducing length of stay.
Older persons tend to have multiple medical conditions that can lead to complicated care and complex care needs, which can be very confusing for a patient trying to navigate a health system when they're going across to lots of different services. So the idea behind integrated care is that you make that journey seamless for the patient.
The Sláintecare reforms are very much in line with best practice from other European countries. But reforms will not happen overnight. What we need now is a strong focus on implementation. As importantly, we need deep engagement with those health professionals at the front line of services, and importantly, of course, the patients.
This is about creating a health service that provides access to healthcare on the basis of need and not ability to pay. It's about providing more services in the community whilst increasing capacity in both our hospitals and in primary care. This is a huge opportunity, a major programme of reform to create a world-class health service that we can all be proud of. I really challenge all of us as citizens and those of us working in the health service to roll up our sleeves and work together to deliver this major programme and create the sort of health service that we really will be proud of.